Hi, my name is Heather Lloyd, and I'm going to be doing a case study on a 69-year-old patient male that's coming to the emergency room with complaint of shortness of breath. Patient reports that his shortness of breath has increased over the last 5 days with chills since he attended a Billy Joel concert. He reports that he has a history of using oxygen at home at night at 1 liter via nasal cannula, but he's having to use that during the day today as well. He does not report any fever or anyone else being sick. For his past medical history, he has a history of COPD, asthma, and herniated disc. For surgical history, he had a spinal disc removed 40 years ago. He does not, for his family history, he does not have anything contributory that relates to his case. He does not drink alcohol. He does have a history of smoking. He quit 6 years ago. He did smoke 1 pack per day for 35 years. He also uses marijuana twice a week. He has a medical marijuana card that he uses for that. He did receive all 3 Pfizer vaccines to cover for COVID. His influenza and pneumonia vaccines are also up to date. He does not have any allergies to medication. For his home medication, he takes albuterol inhaler, Trelegy, Claritin, Norvasc, HCTZ with losartan, and also a multivitamin. For his review of systems, the patient reports no chest pain, no heart palpitations, no dizziness. He does report shortness of breath, no cough. He does not have any abdominal pain. He reports no nausea or vomiting, diarrhea, constipation, no urinary issues, no joint or muscle pains, or any skin problems. For the physical exam, cardiac-wise, he had normal S1, S2. For respiratory, he had some shortness of breath, 22 breaths per minute. He was on 2 liters of oxygen, saturating 98% with that. Blood pressure 133/67, heart rate 70. He was afebrile. He his abdomen was soft, normal bowel sounds. Urinary system deferred since it was not related, and also musculoskeletal and skin assessment was deferred as well. For diagnostic tests, we did a chest x-ray, COVID test, CBC, BMET, and a D-dimer. For differential diagnosis, I have COPD exacerbation, COVID, and pneumonia. Pneumonia was ruled out with the chest x-ray that showed no abnormalities, no pleural effusion. His WBCs were 9.5, so they were within a normal range. And also on the physical exam, he had no rhonchi in the lungs and no fever. So no sign of any septic infection going on. For COVID, that was ruled out with the COVID test that was negative, and also with a patient history of having all 3 vaccines, and also no fever that indicated that COVID could be possible. So for the COPD exacerbation, the coding for that is J44.1. And for the inpatient coding, it was 99222. But the COPD was ruled in with the history of the patient's COPD and also the increased need for oxygen. As far as the impression plan of care, we'll continue to monitor his oxygen level and wean him down as we are able. We'll also be giving nebulizers as needed. We'll be giving Solumedrol IV and to continue his home meds. Thank you.